everyone. Today we're going to discuss about the scapula bone. Scapula is a large flattened bone located in upper posterior aspect of the body. First, we're discussing the part. It is a highly mobile, consists of the four parts. First of all, this is the body. This is and three process. This is the spinous process. This is the coracoid process, and this is a glenoid cavity or this is a lateral angle. Body is triangular, thin, transparent. It presents the following features: two surface. This is called the dorsal surface, and this is called the costal surface, and three borders. First of all, this is a lateral border and thickened border. This is the medial border, and this is a superior border. There is presence of the three angles. First of all, this is the superior angle between the superior border and the medial border. This is an inferior angle between the lateral border and medial border, and this is the lateral angle. Lateral angle is truncated to formatted in the glenoid cavity. Formation of the glenohumeral joint is also called the shoulder joint. Processes. The self-like process present in the posterior aspect of the scapula is called the spinous process, and this is here is presents acromion process. There is bird beak-like process where it originates from the glenoid cavity. It called the coracoid process. So, how will hold in proper anatomical position after discussing some parts of the scapula? दोस्तों, ये चीज़ आप लोग हमेशा याद रखेंगे जब एनाटॉमी भाइबा ऑस्टियोलॉजी टेबल में आपको कि किसी भी बोन दे प्रोवाइड कर दिया जाएगा. ठीक है. फर्स्ट ऑफ ऑल यू सेड समथिंग अबाउट दिस बोन्स. ठीक है. देन होल्ड इट टू प्रॉपर एनाटॉमिकल पोजीशन आफ्टर वी डिस्कसिंग द ऑल द अटैचमेंट एंड द जनरल फीचर्स. ठीक है. सो what is the proper anatomical position of the scapula? The glenoid cavity, this is a glenoid cavity. Here you can easily see that this is a glenoid cavity. The glenoid cavity face laterally, forward and slightly upward, and coracoid process is directed forward, and self-like spinous process is directed posteriorly, and it hold like this. And how we identify this is the which side bone? First we try to identify this is a self-like projection. It's called a spinous process present posteriorly in the dorsal surface, so it may be dorsal surface, and glenoid cavity present laterally. So hold in this position, and which hand you can hold and which sided bone this is. This is in left sided. Let's discuss about the features and the attachment of the scapula. First, we discuss the costal surface. That is called the costal surface. Why is called the costal surface? Because it present behind the ribs, so it is called the costal surface. It is a concave, directed medially and forward. It is a concave, directed medially and forward. It present the three longitudinal ridge, which provide the attachment of the intermuscular tendon of the subscapularis muscles. The subscapular is the multipinnate muscles arising from the medial two-thirds of the subscapular fossa, the costal surface, subscapular fossa of the costal surface, except near the neck where the subscapular bursa intervenes between the neck and the subscapular tendon. There is presence of the subscapular bursa, which intervene between the subscapular tendon and there is a neck of the scapula bone. The serratus anterior muscles is inserted on this surface along the medial border also in the inferior angle. So we completed the costal surface. Now we go the dorsal surface. Dorsal surface is convex. Dorsal surface is convex and is present a self-like projection. This is called self-like projection. Is called the spinous process. Spinous process that divided into dorsal surface into the two type fossa. Supraspinous fossa. This is called supraspinous fossa. This is called the infraspinous fossa. The supraspinous fossa is small. It consists the 2/3 of the body, and it consists the 2/3 of body, and the supraspinous fossa is consists the 1/3 of body, and infraspinous fossa is consists the 2/3 of body. There is present of the notch. Here you can easily see. Here you can present a notch. The notch is present between the neck of the scapula, and there is called the lateral border of the spinous process. In the notch, there is going suprascapular nerve from supraspinous fossa to the infraspinous fossa. Then supraspinatus muscles is arising from the medial 2/3 of supraspinous fossa. So supraspinous muscle is present there, which arises from the medial 2/3 of supraspinous fossa, and infraspinatus muscle is arise from the medial 2/3 of infraspinous fossa. Once you complete, there is the lateral border. Lateral border is thickened. It acts as the fulcrum during the rotation of the scapula, like this. In the lateral border or in the dorsal surface, there is the attachment of teres minor muscle, upper part, upper 2/3, and lower 1/3 is the presence of teres major muscle. But the teres minor muscle is interrupted. Origin of the teres minor muscle is interrupted by a circumflex scapular artery. That means the scapular teres minor muscle is totally not originated. Something in presence, there is a circumflex scapular artery. In the inferior angle of the dorsal surface, there is a presence of the latissimus dorsi. So here we complete the inferior dorsal surface. There we can go the borders. There is in the scapula, there is a 3 border. First of all, this is a lateral border, this is a superior border, and this is the medial border. First of all, we said the superior border. Superior border is the shortest border, and it extends between superior angle to the lateral angle. Suprascapular notch. Here we can present a notch. Is called the suprascapular notch. The suprascapular notch is converted into the suprascapular foramen by the superior transverse ligament. It's also called the superior scapular ligament. The suprascapular artery and the nerves are going the suprascapular notch. The artery is going above the superior transverse ligament, and nerve is going in this region. So there is presence of mnemonic. The Air Force is above the Navy. So the artery is above and nerve is below in the superior transverse ligament. There is also attachment of the muscle. The inferior there is a inferior belly of the ombohead muscles in the arise near the suprascapular notch. There will be discussed and the lateral border of a spinous process. Now we discuss the lateral border of the scapula. The lateral border is the thickest border. Why the lateral border is thicker compared to the medial border and the superior border? Because the lateral border is act as fulcrum during the rotation of the scapula. Scapula is rotated like this. The lateral border is thickest border. There is the presence of upper end of the glenoid cavity. This is the upper end of the glenoid cavity. In the upper end of the glenoid cavity, there is a presence of the tubercle in lateral border. It's called the infraglenoid tubercle. There is a presence of tubercle. It is called the infraglenoid tubercle, and there is a presence of the another tubercle. Is called the superior glenoid tubercle. Inferior glenoid tubercle is the origin of long head of tricep. The long head of triceps is origin of the inferior glenoid tubercle, and superior glenoid tubercle, there is origin of long head of biceps brachii. It is always remember that there are two bicep brachii and bicep femoris. So when you call the biceps, is not right. Always call the biceps brachii or the bicep femoris. Okay, the inferior glenoid tubercle is the attachment origin of long head of tricep. So then later, let's go. We're discussing about the medial border of scapula. The medial border is also called the vertebral border because it's just presence of the vertebrae, and it extends from superior angle to the inferior angle. There is a presence of the angulation in the root of the spine of the scapula. The serratus anterior muscle inserted on the costal surface of the medial border and the inferior angle. The levator scapulae muscles is inserted on the dorsal aspect of the medial border of the superior angle of the root of the spine. In upper part, there is an attachment of levator scapulae. In the root of the spine, there is an attachment of the rhomboides minor, and in later part, it's attachment of rhomboides major. Understand? Rhomboides major, medial border, also the inferior angle. The rhomboides major is present, and the root of the spine, there is a attachment of what muscles? Rhomboides minor. It is the origin of inserted of levator scapulae. Can you see some suspicious thing? Here the all is inserted. Right now, here the all muscles are the inserted, not originate. The levator scapulae muscle is inserted. There is also inserted of rhomboides minor, rhomboides major, and there is inserted of serratus anterior muscle. But in the lateral border, the all muscles are all muscles are the originate. So also there is a tricky things. In we discuss about the lateral border, we always discuss the origination of the muscle from the lateral border, and the insertion of the muscle is the medial border. Now we discuss about the angles of the scapula. There is a three angles. First of all, there is a inferior angle, there is a superior angle, there is a lateral angle. The inferior angle, the superior angle present in the second rib, and the superior angle present in the second rib, and inferior angle in present seventh rib or 7 intercostal space. They may be varied to person per person. But the lateral angle is truncated to formation of the head of the scapula. It's truncated and the pear-shaped articular cavity is called the glenoid cavity that articulate with the head of the humerus like this. It with head of the humerus like this. And formation of the shoulder joint. The fibrocartilaginous rim is called the glenoid labrum is attached to the margin of the glenoid cavity. Deeps is convexity. Deeps is convexity. The glenoid labrum, due to the presence of the glenoid labrum, it helps to accumulate the large head of the humerus in a small articular surface of the scapula. It's like this. The capsule of the shoulder joint is attached to the margin of the glenoid cavity and proximal to the attachment of the glenoid labrum. This is attachment of the capsule. The long head of the biceps brachii is arising from the superior glenoid tubercle. Its origin is the intercapsular. There is a presence of the tubercle. This tubercle is called the superior glenoid tubercle. This is an origin of the long head of the biceps brachii. When the formation of the shoulder joint is formed, the long head of the biceps brachii, like this, the long head of biceps brachii, here you can see long head of biceps brachii is intercapsular. Origin is intercapsular. The tendon of the long head of the biceps brachii is present in the intercapsular. Let's go. Now we discuss about the process. The spinous, there is a presence of the three process. This is an spinous process, this is an acromion process, this is an coracoid process. Let's discuss one by one. First we discuss the spinous process. A spinous process is self-like bony projection. It has a through surface, superior surface and an inferior surface. Superior surface form the lower boundary of supraspinous fossa, and inferior surface form the upper limit of infraspinous fossa. There is a border, anterior border and the posterior border and lateral border. There is the anterior border, there is the anterior border, there is the anterior border, there is the posterior border, is also called the crest, and there is the lateral border. The anterior and the lateral border is formation of the two lip. This is called upper lip and the lower lip. The upper lip, there will be the inserted of the upper lip, there is an insertion of the trapezius muscles. The trapezius muscles is inserted in the upper lips. Let us compare in the upper lip. Upper lip is inserted of the trapezius muscle. It is a lower lip of the posterior border, is called the crest of the spine. It is called the lower posterior fiber of the deltoid muscle. Deltoid muscle, the lower posterior fiber originate like this and is present in like that. Understand what I want to say? Then I go the acromion process. Acromion process is project forward almost to the right angle from the lateral end of the spine and overhangs in the glenoid cavity. The superior surface of the acromion process is subcutaneous. It has two border, lateral border and medial border, and two surface, superior surface and inferior surface. The medial border is continuous with the upper lip of the crest of the spine, and the lateral border is continuous with the lower lip of the crest. The superior surface and inferior surface. The superior surface is rough and subcutaneous, and inferior surface is small and is related to the subacromial bursa. The medial border is inserted of the trapezius muscles, and the lateral border is origination of the intermediate fiber of the deltoid. There is this angulation is called the acromial angle. The junction between called the angulation. This angulation is called the acromial angle. The angulation is formed by this is the posterior border or lower lip of the crest of the spine and the lateral border of the acromion process. Formation of the angulation. This angulation is called the acromial angle. Now we discuss the coracoid process. it is a but big like process that originate from the head of the spine, that originate from the head of the scapula, like this now, head of the scapula. It arising from the upper part of the head of the scapula and bend sharply, project forward and side laterally. There is an attachment of the three muscle and three ligament. First we discuss the muscles. Short head of the biceps brachii and brachialis muscles arising from the tip of the common tendon, like present here. Tip of the common tendon, there is a origin of short head of the biceps brachii and the coracobrachialis muscle. Friends, let us remember where the long head of the biceps brachii originate. The long head of the biceps brachii originate from the supraglenoid tubercle, and there is a short head of the biceps brachii and the brachialis. The pectoralis minor muscle is inserted to the medial border of the upper surface. The medial border of the upper surface, there is an insertion of pectoralis major, pectoralis minor. There is a medial surface, lower border of the medial surface. There is an insertion of the pectoralis minor muscle. Coracoacromial ligament, it's attached to the lateral border. This is a coracoid process. So this is the lateral border, this is the lateral border, here is the lateral border, and here is the medial border. Understand what I want to say? So coracoacromial ligament is attached to the lateral border, and there is also presence of the ligament is called the coracoclavicular ligament and coracohumeral ligament. Coracoclavicular ligament. Coracoclavicular ligament is two part, a conoid part and a trapezoid part. Conoid part and a trapezoid part. And coracohumeral ligament, there is another presence of another ligament, the coracohumeral ligament, that's attached with the humerus to establish the scapular joint, to establish the shoulder joint. Near the tip of the acromion process, there is presence of the small articular facet. Here you can easily see the small articular facet. This articular facet is formation of the joint with the clavicle. Let us see the joint. This joint is called the acromioclavicular joint, like this. Acromioclavicular joint. And previously I said that the coracoclavicular ligament are two part. One is conoid part and trapezoid part. So there is attachment of the conoid part and trapezoid part, like this. From here, conoid part and trapezoid part, conoid part and trapezoid part. Understand what I want to say? Conoid part and trapezoid part. So this is the general features and the attachment of the scapula. Now we discuss about some clinical problems related with the scapula, and very commonly seen problems and related to the problem related with the scapula is winging of the scapula. Normally the scapula is present like 30-degree angulation of the coronal plane, like this. And in the medial border, there is, in the costal surface of the medial border, there is the attachment of the serratus anterior muscle. Now let's remember where the serratus anterior muscle is originate. I am always said the students, when you study any topic, let's correlate with the others. The serratus anterior muscle is originate of the upper six ribs. Upper eight digitation is originate of the upper 8 ribs. So in each case of the winging of the scapula is there is a paralysis of the serratus anterior muscle. So scapula does not return in the original position. That means it does not present in the same 30-degree angulation with the coronal plane. Laying of the scapula is present like this due to the paralysis of the serratus anterior. Now we discuss ossification of the scapula. The two scapula. The ossification scapula is present like this. Now we discuss about the ossification of the scapula. The ossification of the scapula is a cartilaginous. The cartilaginous scapula is ossified by the 8 center, one primary center and seven secondary centers. The one primary center origin in the body and 7 primary center, 2 present in choroid process, 2 present in acromial process, 1 present in a medial border, 1 in inferior angle, and another one is present the lower rim of the glenoid cavity. The primary center in the body and the first secondary center appear in the coracoid process, appear in the primary center in the body is appear in 8 week of intrauterine life and first postnatal life, or mean the first secondary center appears in the first postnatal life. They will fuse in 15 years. The all secondary center arise in puberty, then fuse in the 20 years. The coracoid process in the reptilians, the coracoid process is the separate bone, but in humans they can fuse with the scapula. This type of epiphysis is called the atavistic epiphysis. That's all about the scapula. In examination hall, in the Viber table, you can first identify which sided scapula this is. These are two-sided scapula. This is a left-sided scapula, with a right-sided scapula. In previous lab discussed how we can identify which sided scapula this is. So thanks for watching.